I'm Jenna.
Hello, I'm Gloria.
We are Worthy Wellness
because we are worth it.
Our purpose is to introduce women entrepreneurs, products, and services while proceeds help women in need for holistic care and therapy services.
Welcome, ladies. Good morning, everyone. So today on Worthy Wellness Podcast, we're going to discuss some cases that we had today in our office that basically blew our minds. And so today it's going to be about how the medical community has really just turned everything upside down and how some people are not getting the proper care they need. And thank goodness that Dr. Tobin is going to be with us today because she is our holistic practitioner. And we had some pretty interesting cases. We had crazy stuff today. Yes. So my co-host, hey, Jenna, go ahead and tell them.
Okay. Hello. I wanted to start off with what I've experienced this week. So this is a huge eye opener, and it's such a blessing to come into the office to get a little bit of answers from Dr. Tobin. But what's happened with me is I was pregnant and I had a miscarriage. But during that time of testing, I didn't have any further testing of my hormones. They didn't say that I have infertility because I haven't tried for a whole entire year, and that they wouldn't test me any further for anything. And I just didn't get any answers. So here I am in the office, and I shared this to Dr. Tobin.
I was livid because here she goes in. The natural thing was, okay, yes, we want to check and see if you're still pregnant. We can do that with blood work. But why wouldn't you also check what's going on with your progesterone? What's going on with your other hormones? So we may have a clue why she miscarried. And the fact that she was told, oh, the reason we didn't do that is because you technically haven't been experiencing infertility because we can't show that you've been trying for a year. That is the most ludicrous thing for a doctor to tell somebody. It's mind-boggling. So if she had been trying for a year and she could prove that, they would have done the rest of the testing. That's not medical care. That's just basically running medical care by insurance, because what that was really saying is we don't think we're going to get the insurance to cover it because we can't prove you've been trying for a year. Not what do we really need to know to give you good medical advice. And that is so upside down when she didn't get the care she needed because indirectly her insurance wasn't going to pay for it. She wasn't even given the option of, you may have to pay for this out of pocket. Do you want to do that? That would have been at least something to say, I don't know that your insurance is going to cover it. Do you want to spend a couple $100 so that if you get pregnant again, or when you get pregnant again, we will know if we have to support you with extra nutrition, extra hormone support, or what needs to be happening so you don't miscarry again. But she was never given that option. No. And that's what I'm so frustrated.
And I would have paid out of pocket because that was the most crucial time sensitive moment of doing blood work. Is why would I go in and get another blood work and then maybe that time passed to really figure out. Exactly. And it was just the same that they never asked. Right. Or that I didn't know that they weren't testing.
So what we did decide we're going to do with her is, and it's okay if I share this, yes, right?
Most definitely.
So what we are going to do is when she starts her next menstrual cycle, we're going to do saliva testing. And the reason I want to do saliva testing is because we are able to take saliva from her over the course, or basically she's going to provide the saliva. We're not taking it from her, but she's going to provide saliva in little vials throughout the course of the next month. And we're going to send all those vials into the lab at the same time. And so the lab is going to give us a report during your entire menstrual cycle. Here's what your estrogen levels were doing. Here's what your progesterone levels were doing. Here's where you had your luteal surge. So we know exactly what's happening. So if she's not able to produce enough progesterone, we're going to know that already. So we can start working on that so we can get ahead of the game so that her next pregnancy goes to full term. So there are things that can be done for testing, and the saliva is much more helpful in that respect because it allows us to see what's going on over the course of the month, versus if you just do blood work, you're not going to do blood work every few days. And so you really only know where the blood levels were on a particular day. And since hormones are supposed to fluctuate throughout the course of the month, it just gives us very limited information. For her blood work to hormonal wise to be off, it has to be off the charts off before it actually, shows, gives us any valid information. So that's what we're going to do with her next menstrual cycle. And anybody who is suffering from fertility issues, it can be so heartbreaking and so frustrating. Every month it's just, oh, here's my cycle again, or yes, I'm pregnant and then I miscarried, and not knowing why. Since the ability to determine those things is out there, I'm a huge proponent of let's use them.
Most definitely. So thank you so much. I'm glad we have some kind of plan for me.
We have a plan.
Versus
Right.
no plan at all.
And some answers, because it's stressful, it's heartbreaking, and people just want answers or some help, some assistance, some emotional support. So
Right.
Dr. Tobin, it's going to be great for you and Jenna. I'm really excited for her. Yeah.
So when you go and have blood work done, get copies of your blood work. Do not go with the doctor told me everything was fine, or get copies of your blood work yourself and take it to somebody who's holistic, read it yourself, take it to another person for a second opinion. Because I had a patient who he's one of my patients that is I do online coaching with he and his wife. And he said, well, my doctor wants to put me back on a statin, which is a cholesterol lowering medication, like Lipitor, one of those. And he said, I sent you my blood work. And I said, okay. So I look at his blood work and I said, well, this blood work was done when you were not on a statin? He goes, yeah, I'm not taking any statin medications at all right now. I said, but this blood work is perfect. His cholesterol level was well under 200. His healthy HDL was like 80, which is, double minimum. His ratio was like 2.2 so that means his risk of heart disease is less than 1/2 of normal. So all of those markers were good. His LDL cholesterol was in range, and he says, but my doctor likes to see it under 100, and it was 104. And so every single one of his markers was absolutely perfect marker. And the only thing his doctor could say is, well, even though that's still in range and everything looks perfect, I like to see this a little bit lower, so I'd like to put you on a statin. I said, there's no medical reason based on this blood work to put you on a statin. I don't understand. Why would you want to do that? He goes, well, and my doctor mentioned that my mom had a stroke. And so because my mom had a stroke, he thought it would be a good idea for me to take cholesterol medication. And the gentleman's wife chimed in and said, but your mom was also diabetic. And I said, yes. And your mom probably didn't have blood work that looked like this. He's supposed to be treating you. He's not supposed to be treating your mom. So giving him the scare thing of, you could have a stroke because your mom died of a stroke, versus look at your blood work and I'm actually treating toward your blood work, it didn't make medical sense. And what was very frustrating about it, and I get why his doctor's doing that, in that the doctor is covering his own tush, in that there's no guarantees. This person could die of a stroke, whether he's on cholesterol medication or not. But if he's on cholesterol medication and he dies of a stroke, the doctor can wash his hands and goes, I did everything. I did absolutely everything I possibly could for him. Versus actually really practicing medicine and not just working to cover himself and saying, you do not have any markers that you are actually a viable candidate to be taking cholesterol medication. So then fast forward this discussion with this patient a little bit further. And he said, well, this same doctor did refer me to a hematologist because he saw some other things in previous blood work that indicated that I may have a liver problem, which made me livid because cholesterol inhibits liver function. The cholesterol medication inhibits liver function because your liver produces cholesterol. So that's why if you're on cholesterol medications, you have to have your liver enzymes checked regularly to make sure that the cholesterol medication isn't damaging your liver too much. So this same doctor that was concerned about his liver on previous visits now wants to give him a medication that could damage his liver to treat blood markers that are already perfect. The logic of that was just mind-boggling. This is not the first time I've seen something like this. So this is very common. So that's why I tell people, if you're going to have blood work done, get your blood results and look at them carefully yourself. Because oftentimes, not only do they try and give you medications when it's not justifiable, but they also say things are fine. And I see that on the other end where people aren't told, oh, you're borderline diabetic, until they're actually full-blown type 2 diabetic. Whereas they could have been dealing with diet and exercise and a lot of other things prior to, okay, now you need to be on metformin or glucophage, or maybe it's so out of control you need to do insulin injections. It's crazy that they let people get so far out of control. So when you get blood work done, read your blood work yourself. Do not just accept what you're being told is always in your best interest, because sometimes, I don't know if it's for covering yourself from a malpractice, dealing with standard of care, dealing with insurance issues, being overworked, because doctors are overworked. They are only given a very small slot of time to deal with patients. I'm not saying that doctors are bad doctors. There's just a lot of strain on them with the current medical system we have going on. But these things were mind-blowing to me. So,
yeah.
And
right.
That's really what I would encourage people. When something is recommended, it's just a recommendation. You are still responsible for your body. You're the person who has to live with the results of this. Anybody else can just walk away. You're the person that's stuck with the outcome. So make very sure that you're very clear that that's not something that you're making a decision rash, and that you have all of your information, and that you feel really comfortable with your decision. Don't be pressured into doing any medical procedures that you don't feel comfortable with, or taking any medications that you don't feel comfortable with. This is your system, and the way we're supposed to work is you're supposed to have dominion over your own body and not be forced to take any type of medical intervention. So that's my big takeaway from all of this today. Use your own common sense, realize that you're the person who has the ultimate responsibility, and do your due diligence before you do any type of intervention.
I agree. I absolutely agree. You couldn't have said it. I mean, we're ready for this one today.
This was crazy.
Yeah,
we didn't have a subject until today happened, and we're like, yes, we now have a subject.
We now have a subject because it's important. We're seeing that more and more. You have to be your own advocate. You have to ask the questions, get a second opinion. You have every legal right to do that. If you have medical insurance, you have every legal right to get up to three opinions. You do, especially if it's in regards to surgery. So always remember that. Always remember that.
And that is the value of a podcast like this, because there may be somebody out there who's experiencing a fertility issue, or has just been given a recommendation on a surgery or a prescription, and they're like, I don't know if I really want to do that. And I'm really hoping that the podcast will help people to say, wait, I don't have to do that. This is me. This is my body. I don't care what my insurance company says, my doctor says. I kind of intuitively know what's best for me, and go with that intuition, because that's oftentimes divine inspiration. And don't ignore it, but actually follow it.
Listen to that divine inspiration. I believe that. I think it's great. Yeah.
Yes. Definitely. So that's a wrap, huh?
That's a wrap.
That's a good wrap.
That's a good wrap. Yeah.
Okay. So I just wanted to give a positive follow-up to these cases that patients do not have answers and are stuck, and perhaps they are searching for answers or a pathway. And this is exciting because we have a special announcement. Dr. Tobin is publishing her book, It is called Holistic Healing Power. Ancient wisdom meets modern science. Resolve the root causes of chronic conditions. Transform extreme fatigue into energy and vitality. Effortlessly achieve and sustain your weight loss goals. Discover the holistic secret to hormone balance. Author Dr. Mary Tobin. So this professional holistic medicine is for when conventional care disappoints. It's a personalized holistic medical care. You can pre-order Holistic Healing Power book. There's professional holistic formulas and supplements. You can reach tobinholisticmedicine.com or call 714-256-2287. You can also visit the clinic at 710 North Brea Boulevard, Brea, California, 92821. We would also love to share that Dr. Tobin is supporting both Gloria and my nonprofit under the charitable organizations. They will be stating Worthy Women Warriors and All Care Anywhere. We are super excited to be published in a book and to spread the word for holistic approaches and supporting nonprofits as well. If you're also a woman entrepreneur to support our cause and would like to be considered on this podcast, please reach out to us. We would love to connect. We see you. We want to connect, empower, and inspire others. So please call or text or even fax 949-793-8781. Or our Instagram is Worthy Wellness Inc., like INC. Hope to hear from you, and thank you for listening.